Today, for all the controversy surrounding fraud in state programs, we also have the opportunity to make Minnesota a national model for combating fraud, waste, and abuse. Governor Walz is leading that effort, and for the past year, I have been working to do this, and I will continue to accelerate change within DHS to prevent and fight fraud. We have a consensus around an outcome: zero fraud in our programs. So it's time to think big and act boldly. This week, the Minnesota Program Integrity Director, Tim O'Malley, provided his roadmap report. He found that more than 50 years of neglect of program integrity and oversight efforts created the conditions that bad actors have exploited. He said the state has a lot of work to do to make the next half-century better. The governor's executive order, issued in September of last year, accelerated the work that DHS can do as a state agency. But we can't do it alone. As you've heard me say before, there are important changes that require all of us to come together. We need the support of legislators, and we need to tackle these issues during this current legislative session. The governor's plan covers a lot of important ground. For the Minnesota Department of Human Services, it will strengthen our hand in working with managed care organizations. The health plans in Minnesota handle about 80% of Minnesota's Medicaid enrollees. The governor's plan calls for enhanced oversight and increased review of claims that are being paid. We're also tightening oversight of the way we provide services to people with disabilities and older Minnesotans. We're establishing billing limits, new billing limits, requiring providers to keep digital records documenting services provided, and requiring pre-authorization for some high-cost service plans. Last year, we implemented reforms to the Early Intensive Developmental and Behavioral Intervention Program, which cares for children with autism, including the ability to do on-site visits when the provider has not submitted claims. In this legislative session, we are asking for the authority to expand that same ability to do on-site visits to other healthcare programs. There are over 1.2 million Minnesotans who depend on Medicaid services for life-saving and life-enhancing medical care. Almost half of them are children, as the governor noted. We owe it to them to come to the Capitol and have the frank discussions necessary to ensure that they have the care they need.